G'day and Swati Karb. Well, today we were blessed with another talk from Dr. Pantalee from Pantalee Hospital, and I have to say, welcome. And I don't think I've ever met a doctor, very few doctors who are as dedicated as you are to non-medical treatments.
Oh, really?
How did you become so interested in natural ways of treating, say low testosterone or low estrogen as we talk today? How did you become interested in it?
Yeah, I think I have a natural tendency to be interested in the natural approach because I think the conventional way could not fix the root cause of the problem. And if we incorporate the natural way and the simple way is to eat healthy foods, but we have to specify which is the healthy food that we should eat in order to solve specific problem that we have. For example, like testosterone. Yeah.
So this is a problem with, one thing you did mention was that women find it easier to identify when their estrogen level drops because they get menopause, right? They sweat and stuff. But with men, it's harder to know when their testosterone level has dropped. So how can men get a clue that their testosterone level is too low?
First of all, the key is performance. If you think about your performance, maybe within the past 5 years, if you have low performance in every single aspect, like working performance and mental performance or sexual performance, this is the early signs and symptoms of low testosterone.
So say that I develop the suspicion that I have low testosterone and I come to you. What do you then do? So I come to you as a patient.
Sure, we have to measure your testosterone level. In serum would be the easiest way to do that.
But you can also do it from saliva.
Yes, we do have this new advanced high technology to measure testosterone, but it's a little bit more expensive. Yeah.
And one of the things that really came out is that a lot of people self-medicate when it comes to testosterone. And I know people who basically self-medicate here. But there's a problem with some of that form of self-medication.
A lot of problems and a lot of side effects from that. We do have a lot of my patients coming to see me to fix the problem. And some problem can increase your cardiovascular risk. For example, too high concentration of red blood cell can cause you a thrombosis or heart attack. This is the example of too much self-medicated of testosterone.
Yeah, and you particularly emphasized that tablets could be a problem, that some people are still taking actually testosterone tablets, which they might get off the web or somewhere.
Yeah, this is old school and old version. It's outdated because we have newer and newer medical findings and literatures that shows and prove that testosterone pills are very bad and have a lot of side effects involving your kidney functions, your liver functions. Yeah.
So, and one of the things I mentioned in my question is the grumpy old man syndrome. That's, I see people, and that's a sign of a low mood because of the low testosterone.
Yeah, we can suspicious for that.
Right.
Yeah.
Well, if you want to have she had prepared a really, really informative PowerPoint presentation. So if you watch the talk, of course, the PowerPoint presentation's in the background and you can pause it and take notes. But if you've got any sort of suspicion that you'll have estrogen or low testosterone levels, because it's not just about the testosterone, it's a balancing act, isn't it, with testosterone, because it transforms.
Right. Testosterone is unstable molecules and can be transformed or converted into different kind of molecules, and we have to rebalance and look deeper at the ratio of those kind of hormonal molecules.
And also there's a difference between free testosterone and non-free testosterone.
Yes. Normally we do have bound form testosterone and free form testosterone. So the active form would be free forms.
And that's the sort you need to increase your performance?
Yes, right.
So there you go. So really have a look at the talk and really take notes from the PowerPoint presentation in the background. Really want to thank Dr. Pantalee for another fantastic talk and very popular talk again. So thank you, and thanks to Pantalee Hospital. And next week, very exciting, words and dance. We're going to have a dancing student here with a combination of talking about her experience and dancing. So we'll see you. So until then, it's goodbye and Swati Karb from Renlex Sander and Pattaya City Expat Club.
Thank you for having me.